So, for those of you who watched the Viewpoint debate on cannabis a few weeks ago, you may remember being touched by the story of a local man named Brian, who asked Minister Sacramento when the government would be making medicinal cannabis available to people like him. Now, I spoke to Brian after the show, and he agreed to share his story with us, so he came round for an interview, which was kindly conducted by local freelance journalist Mark Viales. We did this last week, but I haven't had time to upload it until now. Also, a big thanks to everyone who messages me and stops me in the street to give me their support on this issue. It means a lot. So, without any further ado, this is how the interview went down. I hope you all enjoy it.
Well, thank you very much, Nathan, for that intro on this subject. We're here with Brian, who is suffering from acute chronic fibromyalgia with chronic fatigue syndrome.
That's right.
So, Brian, thank you very much for meeting
Thank you, Mark, for receiving me.
Okay, Brian, so could you tell us what it's like to live with fibromyalgia?
Well, my fibromyalgia, I didn't know I was getting fibromyalgia. 9 months ago, all of a sudden, the muscles of my body were just breaking down, or it felt like the muscles were very severely pulled. It started with one muscle in the leg, then a muscle in my shoulders. I went to orthopedic surgeons and I thought I had a frozen shoulder. Then my back muscle went, and my orthopedic surgeon told me that he didn't think that it was frozen shoulders. He thought there was something more sinister behind these muscles, sort of like not rupturing, but sort of like pulling themselves, no?
Tell me what effect it has on your family.
Well, just imagine, Mark, that they were all very dependent of me, and all of a sudden my condition has broken their hearts, and they are very stressed out to see that I honestly cannot help them out. Mark, if my wife collapses on the floor, I can pick her up, Mark, and I can put her into bed, Mark. But the pain and agony that I go through afterward is tremendous. So now, if things like this happen, I call the ambulance. And it's a bit pathetic that I have to call the ambulance, and this is all due because I'm not given a medication, Mark. I have had the proof, and I have experienced the difference now, because somebody has come to my house, not somebody, hundreds of people have been calling me at home, giving me support, but I have had more than 20 people who are in clandestine using oil cannabis in Gibraltar. So I have had the opportunity of trying the oil cannabis in Gibraltar at my house. Somebody from society came to my house to let me try it out, and I can assure you, Mark, this was life-changing.
How so?
One drop, not one drop. The gentleman that came to my house produced this oil in a vaporizer. It took me 2 drags of a vaporizer, and I was out of pain for 8 hours, Mark. I could not believe that. And my mind had changed dramatically from being depressed and negative to having a complete positive mind, Mark. I wish the whole of Gibraltar could experience what I experienced that day. But unfortunately, that oil that was given to me is from a person's own stock. So I cannot deprive him from his cure. What is necessary now in Gibraltar is for the medical community to realize that the vast information out on the internet, 4 million people using it in America, 600,000 people using it in the whole of Europe, and not for MS. They are using it for chemotherapy, for chronic fatigue syndrome, for pain control, for Parkinson's disease, for babies with severe fits. We are so modern in Gibraltar, you know. This is what shocks me more. We like to boast and brag that we're the world's 3rd biggest economy. We talk of our cultural tolerance, that we're an example to the world. Thanks to God that we allow gay people to marry. But when it comes to Satidex, which is just another ordinary drug, probably less harmful than the diamorphines, the morphines and the heroin that we use in the hospitals, I cannot believe they want me to carry on going to hell. Does this society want me to commit suicide before they actually give me a cure?
How does it make you feel to see this motion being passed and merely for MS patients, considering that you were stated
I am very
happy
because this is a step forward, obviously, I'm not going to be negative. This is one step forward. But I would like somebody in a position to make sure that MS patients are being offered this drug. It's not good to say that you passed the bill and we're going to give them to the MS patient, and then the doctor that's behind it doesn't want to prescribe it to them, is it, Mark?
No, of course.
I mean, you've got to help patients out. I mean, I've dedicated 40 years to acute nursing, acute surgery, and 14 years in an operating theatre where my main job was controlling of pain. Now, I happen to be an unfortunate case where I'm allergic because of my asthma to all these things.
So how does it make you feel as well to see that there's people within our society who are looking outside the box like yourself, and still no real consensus from the government to follow up?
I feel very annoyed. I feel very annoyed and angry to see that our country can be so modern in everything, and then when it comes to the pain and suffering, because we don't fall into the category of MS, I will not be getting it, Mark. I'm a fibromyalgic patient with acute fibromyalgia. It doesn't fall into the new bill, does it, Mark? So that means I'm not going to be made an exception. So what is going to be my cure? I have to go to the UK?
So let's try and establish, when you're already diagnosed with acute fibromyalgia, in the GHA, they have prescribed you several things which you are allergic to because of your asthma.
I went through a trial of treatments, Mark.
Give me some examples of these treatments.
I went through duloxetine, paroxetine, Stella. These are all psychiatric drugs. What they actually do is they stimulate your brain to produce serotonin. Serotonin will send a message to the block inhibitors, the ones who actually block the pain. Unfortunately, Mark, I'm on the maximum dose of paroxetine already, and it's to no effect. But I have tried the others. You know what I mean? I've gone through 5 or 6 different pills which have given me bad side effects.
Like what? What kind of side effects do you have?
Well, imagine sleeping 3 hours in 24 for 5 or 6 months, because serotonin is used in Japan as the happy drug, the paroxetine. They give it to people who are shy because apparently it gives you a very positiveness, and it's sort of like giving you a high, but with a with a registered legal drug, paroxetine, no? Because it does give you very positive mind, but it keeps me awake all night. And then they wanted to prescribe night sedations and diazepams. Look, Mark, I think that Sativex would be doing better than night sedations, than all the diazepams, the painkillers, and the serotonin stimulants, because all those 4 drugs meant nothing to me the day I was given 2 vaporizers. When I vaped twice, I did not need anything for 9 hours. How can they say no to me, Mark? And not only to me, Mark, but Gibraltar should be embarrassed to see that there's so many patients using this from La Linea. They're going over to Spain to buy this oil. They're giving it to their children. They're giving it to their parents. What does government need? Do we all have to come out into the public and into the casements in the thousands to say how many people are actually using it? I don't understand, man.
Surely it's too much, no? That they would treat, like, knowingly with your condition. Surely they would have some compassion for you, no?
No. The doctors they tell me, the 2 consultants that are seeing me in the hospitals, which I can complain nothing about them because they've done all sorts of investigations, scans on me. They brought the neurosurgeon out. Now I've gone through everything. They were wonderful to me, but their hands are tied. They tell me, Brian, I would personally give you prescribe the Sativex right now. Find me somebody who would authorize me. Didn't it, Mark? It's horrifying to see that 2 consultants cannot prescribe what they reckon is my treatment, Mark. Forget what government says. I do not care what government says. I know it is not government. I know it is one man. Surely the health minister should have called me by now, Mark. Since Thursday that Minister Sacramento told me that they would contact me, I have not been contacted by Mr. Costa at all.
No, Mr. Sacramento?
Mr. Sacramento called me on Tuesday morning to let me know that Mr. Costa would be in touch with me immediately. I'm still in pain, Mark. I have got nothing. They are not helping me out, and this is the irony of it. This is my party. I do not understand why I'm being treated like this. I do not understand how nobody has phoned me except for Marlene Naon from the opposition. That lady whom I don't know has phoned me Friday, Saturday, Sunday, Monday, every single day, Mark. What my party has not done to me, I do not understand. Don't they realize that when a man goes on live broadcast it's because he's exhausted every channel? I tried through 5 weeks trying to get in contact with Neil Costa. I explained to his PA the gravity of my situation. The gravity in the sense not that I'm going to die, the gravity of pain, the severeness of my pain. And here I am. I had to go to live TV, and even going to live TV, he hasn't bothered to call me, Mark. He is not in pain.
So what are you going to do?
Well, I am going to carry on hoping that the society will produce a little bit further along the line. Somebody might have extra medication in the house which they can give me, because I mean, after experiencing what 1 drop of cannabis oil does, it is life-changing, Mark, life-changing. My children say that it was totally different. I had the best day in my life for 9 months, Mark, and I slept 9 hours at night. But I haven't got the treatment, Mark. I'm back to square one.
How fearful are you?
Very
the fact
fearful.
that this isn't.
I now, this morning even more fearful, Mark, because the bill has been passed and they are already telling me personally, it is only for MS patients. Would you not feel like that, Mark? After everybody is not looking after you like me? The passing the bill stating it is for MS, they're already telling me, Brian, you're not having any chance of getting this.
Do you think perhaps the government, who essentially have spoken about this in Parliament with Marlene pushing for this issue as well, do you think they've been a bit negligent? Do you think they're neglecting you? Yeah.
Yes, they are. I'm not going to say the government. I will pinpoint Mr. Costa, because he's the health minister. He has not called me. And I think that after dedicating 40 years of service to the community and being such a good nurse like you tell me, I think that I should have had not special treatment, Mark, but an exception could have been made because of my pains. No, Mark?
So I don't think we spoke about this actually. How did you come to discover cannabis as a possible alternative treatment?
Well, one of my consultants told me, because he has recently come from the United Kingdom. Obviously he's very well informed and he has had many patients himself on Sativex in England, so this man has got quite a bit of an experience with it. And he suggested me to look into Sativex and see whether I would be willing to try. That's before he knew that Sativex was not going to be prescribed to me. So he had to refer me to the most senior consultant in the hospital, which is another colleague of mine for many years, and he told me, as soon as he saw me walking in, he says, "What is going on with you, Brian?" When I explained, he told me, this is the most senior doctor, the most senior consultant in the hospital, said, "If I had the authorization, you would be on it right now. This is inhumane the way you are." They have seen me running those corridors for 40 years, Mark. Now I've got to walk slow motion. My life is slow motion. If I fast walk, I hurt my legs, I hurt my spine, everything is in pain and in ache. It's not fair, Mark. It's just not fair. After all, I feel that I have done so much for so many people in Gibraltar, you know, out of my heart. I don't want anything in return, Mark. But for God's sake, don't deny me my pain relief.
So 9 months ago, you were struck with this condition. When did you start? You said you started taking or vaping or taking some form of cannabis derivative, or however we want to put it.
A week ago, after Viewpoint, is when people started knocking on my door.
No, but you started taking it 5 months ago, you said?
5 months, yeah.
Right.
No, medicinally, no. Medicinally, only 1 week ago.
1 week ago, you started taking it.
Yeah,
right.
thanks to the Viewpoint program.
Right, so you hadn't taken it prior to that?
No, prior to that, I was using the actual cannabinoids,
Right.
the hemp, not the resin, the hemp, on my salads and on my fruits. That is the way I learned through internet. But it's not as effective as vaping, as taking a vaporizer or as taking a drop into your mouth. Okay, it's incredible. I have seen the children that came on Viewpoint, those handicaps I have seen personally. I have seen their reactions. I know the improvement. How can doctors and anybody deny those children the right to have side effects? These are children who are so spastic they can barely move, and they happen to be, his father happens to be a very close friend of mine, and I have seen the reaction when the father puts the drops into his children's mouth, how they can move. It's unbelievable. It's inhumane. It's
How they don't allow this.
yes.
So let's see, run us through your average day using this treatment and how does it alleviate you?
Well, thanks to very, 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 very good people in Gibraltar, I was given a sample dose. I am being able to
A sample dose of what exactly, sorry?
of oil,
Of oil.
cannabis oil,
Cannabis oil.
but it belongs to a patient. That is his treatment. So he gave me a bit to try. He came to my house. I vaporized. This cannabis oil was put into a vaporizer. I vaporized 2 times, and it was 8 hours relief, Mark. 8 hours relief.
Wow.
No pain.
What went through your head considering 8 hours of relief and
I couldn't
you
believe-
never had that?
Oh, I must specify. This is very, very, very important. The drop of oil of cannabis does not give you a high, Mark. It takes away your pain. This is what was most amazing to me and more surprising. I thought that because I was going to take that oil, I was sort of like going to be stoned or on a high. No, I wasn't. I was just out of pain and living my normal life. I was able to play with my grandchildren that day. I was able to play with my son. Unfortunately, the following day, because I didn't have the oil, I was agonizing again. But I know how life-changing it is. And if government doesn't give it to me, I will have to rely on those very nice people in society who are helping me out at the moment.
Yeah, and that was the oil and the vaporizer.
The vaporizer is tremendous. It has been totally life-changing for me. I cannot thank these people from Gibraltar who are doing the work the doctors should be doing.
So like I'll try this again. Like run me through like an average day when you're vaping, for example. You wake up and
When I wake up, I'm stuck. My muscles are all stuck. I'm in pain. My chest feels like the ribs are stuck to the lungs. So it's pretty agonizing to get out of bed in the morning. So I get up very, very, very slowly. I walk very, very, very slowly to my living room, and my wife has already got breakfast there for me. Once I've had my breakfast, because I am not used to these things, I am very scared of using these things because although I've been researching a lot, I'm still a bit sort of like apprehensive on the use of it. No?
why is that?
Because of the taboo that everybody puts into you and indoctrinates since we're small.
So you take that first vape after breakfast, and how do you feel?
I feel the pain going out immediately. Immediately. The effects are immediate. This is why I say this is life-changing. I have experienced something that I have only seen before. When a patient is in acute pain and I've come up with my morphine after surgery and given in it morphine, and you get that relief of pain, and I say, oh, thank you, Brian. No? Well, that happened to me for the first time in my life. I had been 9 months in agony with cold thermals, hot baths, you know, trying all these medications, nothing. And here comes along a middle-aged man, knocks on my door,
Just like that.
and he says, Brian, can I come in? And I says, please do. He says, I've got something I want you to try out. And I couldn't believe it, Mark. I could not believe it. My wife cannot believe it. And my children, they say, Dad, what a change in your life, Dad. Obviously, I'm not going to return back to 100%, but I was 80% disabilitated until this man came to my house and he gave me 8 hours of pain-free body. I was able to do things. and I was able to laugh, Mark, because it's the cannabis oil does not only take away your pain, it gives you such positiveness that it combats the chronic fatigue syndrome to a point that today I'm sitting here giving you an interview. You would have asked me 9 days ago and I would have said no, because I wasn't going out, because chronic fatigue syndrome, you don't want to do anything, Mark. You just want to lie around and do nothing. Not even talk to my own family at home. Not even watch TV. I mean, in a world of depression, Mark. Yeah. And all of a sudden, my life has been returned to me. I swear to God that I am not exaggerating. This has been life-changing, and I want Gibraltar, I want other patients to have what the society is giving to me, because I'm not receiving it through medicine, through the doctors. Yeah. This is through society. There are so many people using it in Gibraltar because of their own health that it's incredible. The government should be looking at this and not playing a blind eye to it.
So, what would you say, on that note, what would you say to those who are still against legalization of medical cannabis?
I'm not going to ask anybody to go into the internet. I'm going to ask government to please bring from outside, from abroad, a PhD on cannabis oil, so that some professor from abroad, I understand that Israel is one of the countries who most use cannabis oil, so why can't we bring somebody over and educate our doctors and educate society that this is not a drug, this is just another medicine.
What would it mean to you to be able to purchase your medication with ease and without stigma?
Oh my God, it changed the whole world for me, because I mean, I'm using it hiddenly now, no? So what can I expect? The police to knock on my door and search for my oil? Or what am I to expect now, Mark? I am not doing anything illegal. I am asking it publicly. I want cannabis oil because I cannot take another thing. If they don't want to give it to me, and if I have to go to somebody's house to get my doses, well, I will, because they're referencing. I'm not smoking joints because I'm a bronchial asthmatic, so I cannot smoke a joint. I need the Sativex. Am I not a genuine case? Does government and doctors do realize it's just one? Doesn't government have the power to say, let's make an exception with this case?
Considering the numerous reforms worldwide on the laws surrounding medical cannabis, what would you change in Gibraltar if you were in charge?
If I were in charge, and if it was my decision, I would definitely bring somebody from outside and let him educate our doctors, and we could have him coming on national TV and educating society, explaining to society how Sativex or cannabis oil is less dangerous than morphine, opiates and diamorphines and heroines and cocaines that we are using in medicine today. That's what I would do. Yeah. And I would not just prescribe it to MS patients. I would prescribe it to the variety of patients that are using it in England, in America and in the whole of Europe.
With many different conditions.
With different conditions. They're given for multiple different conditions, not only for multiple sclerosis.
Yeah, I mean, if you were sat in front of the Chief Minister right now, what would you say to him?
I would say to the Chief Minister to please look into the Sativex and the cannabis oil and allow it in Gibraltar for the relief of the patient's misery and agony that I am going through.